Well, thanks, Doc, for the introduction. Thanks to Jordan Walker for hosting us here in his riding. We also have a number of our candidates here, so pleased to see you all. And Dr. Raj Sherman, who has been a dear friend and close advisor to me on healthcare issues for as long as I have known him. I am just so grateful that he was able to give us some solid advice as we went into healthcare reform, and acting on the advice that he and many others that he introduced me to, we were making real progress, as you heard about. But I am looking forward to working with Dr. Sherman in the legislature, and thanking Jordan Walker, who's just been a great MLA and advocate for Sherwood Park. And this health centre is extraordinary. I had a chance to have a tour before I came to the podium today, and it's remarkable. As I mentioned, we're also joined by a number of other frontline healthcare workers who are running as UCP candidates. We've got Miles Berry, who is our candidate in Edmonton Gold Bar, and he is a registered nurse. And we've got Terence Vanka, who is running in Edmonton Riverview, and he is a dental surgeon. I want to start today by thanking Alberta's frontline health workers for your incredible commitment to the health and well-being of Albertans. For months, our UCP government has been working to accelerate healthcare reforms that our province has needed for far too long. I'm so proud of the work that our team has done. Together, our reforms have already begun to decrease ambulance response times, emergency department wait times, and surgery backlogs. We've also begun to recruit more frontline workers, especially in primary care. Our UCP government has already started on an ambitious reform strategy, but we can't stop there. More needs to be done to ensure that Albertans have access to world-class health care when and where they need it. We need to keep Alberta moving forward. In our recent budget, we increased overall health spending by $1 billion. That increase will help us continue moving forward in righting the system, and there are more improvements ahead. And today I'm pleased to announce the United Conservative Public Health Care Guarantee. Under this public health care guarantee, the UCP is committed to all Albertans that under no circumstances will any Albertan ever have to pay out of pocket for access to their family doctor or to get the medical treatment that they need. And it means that a UCP government under my leadership will not delist any medical services or prescriptions now covered by Alberta Health Insurance. No exceptions. Now, many of you have seen that the Alberta NDP has been lying to Albertans about our government's position on public health care. That's because they know that the only way that they're going to win this election is if they can scare enough Albertans into thinking that the UCP is going to make them pay for health care, or is going to steal their pensions, or who knows what else. But Liberal, NDP, fear and smear politics don't work in Alberta. Albertans have always seen through these lies for what they are, and they will see through them again. So as we keep moving Alberta forward with our ambitious plan to improve healthcare outcomes, rest assured you will never use a credit card to pay for a public healthcare service. You will only ever need your Alberta healthcare card. Just last week, we announced an investment of $237 million over 3 years to expand and modernize operating rooms across the province in our existing facilities, an investment that will reduce delays in hip and knee replacements and cancer and cataract surgeries, to name just a few. That investment alone means that Alberta's public health system will have an increase of 20,000 more surgeries in the next 12 months and increased surgical capacity in more than a dozen communities. That means 20,000 more Albertans will get their surgeries done sooner and closer to home. Under a re-elected UCP government, your Alberta health care card will be your key and the only key to accessing world-class health care every Albertan deserves. We are making historic investments in health care, including and especially in primary care, because every Albertan deserves a family doctor. Just as Dr. Sherman mentioned, when Albertans receive primary care, fewer are going to need urgent care or emergency room care. That means that for our doctors, our nurses, our paramedics, and other allied health professionals who are the most important resource in our healthcare system, help is on the way. Their talent and dedication to keeping Albertans healthy helps to make our province stronger. And that's why our UCP government is putting more money into recruiting and training to expand our health workforce, and also supporting and retaining the incredible health workers that we already have. More help is on the way. A UCP government will continue to ensure that Albertans have public access to a family doctor. That is our public health care guarantee. Doctors and clinics like the one you're at today, they're small business owners. But when you and I go for a checkup, you don't need to pull out a credit card, and you won't have to. With a UCP government, you will never have to. No Albertan will ever have to pay to see a family doctor out of pocket, because a UCP government is committed to a publicly funded healthcare system. And as we continue to invest and innovate to deliver on the reforms needed to move Alberta healthcare forward, we will only look to add new publicly funded services. And just look at our record on this. Under the NDP government, they were charging $40 per day for somebody to access a publicly funded treatment bed. We eliminated that user fee, and now we have access so that people can receive addiction services, which is an essential component to healthy living, without having to pay a fee. It's increased the accessibility of the system, and we intend to do more of this. We will not delist any health services currently available, because Alberta cannot go back. We cannot afford to go back to the NDP making life more expensive by raising taxes and making promises that they just can't keep. And by raising taxes and driving away jobs and growth, the NDP will undercut the critical funding that we need to keep the healthcare system running. We need to keep moving Alberta forward. The UCP has a very ambitious agenda to improve healthcare outcomes in Alberta, and we have already seen improvements. Together, we will ensure that Alberta can access the world-class healthcare when and where they need it. In Alberta, you will never have to pull out your credit card to pay for healthcare. You will never have to pay for a doctor out of pocket. That is the public healthcare guarantee. Thank you, and I'd be happy to take questions.
All right, thanks. Thanks, folks. As mentioned, the leader, Danielle Smith, will be the only one taking questions today. We will start at the microphone with, please state your name, your outlet. You get one question, one follow-up, and then if time permits, we'll go to the phone lines.
Thank you. Graham Thompson, Toronto Star today. Premier, first of all, did you call the election and just didn't tell us about it? This is a party event as opposed to Premier. That's not really my
Correct.
question.
It is a party event.
Right, but you haven't called the election, just making sure.
No, we're dropping the writ as we promised May 1st. Election day will be May 29th.
Okay, just confirming that. You're under investigation by the Ethics Commissioner. Can you just confirm for us the investigation is dealing with the telephone call you had with Pastor Pawlowski?
I welcome the Ethics Commissioner's investigation. It would be inappropriate, though, of me to talk about the details of that. I'm going to let her do the work, and I'm fully cooperating with her investigation.
So I'm assuming you got word last week of the investigation, but you talked about this on Saturday on the radio program. So did you find out before you went on the radio program or afterwards? Because you were still talking about it on Saturday.
As I mentioned, I want to respect the process, want to respect the role of the Ethics Commissioner. I'm fully cooperating with her investigation.
Next question, please.
Michelle Bellefontaine, CBC. Premier, I wanted to ask you, so First Nations say that the Natural Resource Transfer Agreement violates their treaty rights and is an illegal document that they were never consulted on. So why are you concerned with the Federal Justice Minister saying that he'll look into it if it's something that a First Nation or First Nations is asking him to do?
Well, first of all, the Justice Minister's comments were irresponsible and outrageous. The Natural Resources Transfer Act in 1930 simply gave the Western provinces the same right to develop and control their resources that other provinces in the country already had. It's been enshrined in our Constitution under Section 92 and 92A, and it is outrageous for the federal government to imply that they would take away provincial jurisdiction and provincial rights. We are working in partnership with our First Nations communities to develop resources and look at ways in which we can bring them in as equity partners. We've supported different investments through the Alberta Indigenous Opportunities Corporation. We continue to encourage businesses to seek an equity partner when Trans Mountain is complete. I know that there's going to be an opportunity for a First Nations consortium to buy into that so that they have a long-term revenue stream. We think that that is the pathway to economic reconciliation, but acting as if we can tear up the Constitution, that was irresponsible. And the Justice Minister should apologize for his comments. The Prime Minister should apologize on behalf of his Justice Minister.
But the Minister is saying that he didn't commit to any kind of review. And as a representative of the Crown, hearing these concerns from First Nations, what do you think he should have done then?
The responsible thing to have done would have been to say that the Natural Resources Transfer Act simply gave the Western provinces the same right as every other province in Canada, and that we would be looking forward on economic reconciliation to include First Nations in more projects. But to act as if the federal government can tear up the Natural Resources Agreement from 1930 and act as if they can just unilaterally tear up the Constitution, that's not on.
And next question.
Hello, Audrey Neveu from French CBC. Premier Smith, on February 20, 2019, your predecessor, Jason Kenney, also signed a public health guarantee. So why do you feel the need to do the same? Isn't that something that's kind of a no-brainer in Alberta and Canada?
Well, it's because the NDP keep lying about what it is we're going to do. They keep on acting as if we're going to impose user fees and that we're going to ask people to pay out of pocket. That, if you look at our record, that is not the case. What we've been looking at doing is finding more ways to add more coverage and more comprehensiveness to the system. That was what eliminating the NDP user fees on public treatment beds was all about. Is we know that public treatment of mental health and addiction is an essential part of the healthcare system. So one of the first actions our government took was to eliminate that user fee. And we're going to look at ways to make the system more comprehensive. We have to correct the record. No one is ever going to pay out of pocket to see a doctor or receive medical services. We are looking at ways to make the system more comprehensive to cover more treatments.
A lot of those concerns seem to have stemmed from your proposition of a health spending account, which is in the health minister's mandate letter. So why don't you propose that idea to electors so that they know exactly what you're offering before the election?
The health spending account is to make the system more comprehensive. The thing I find remarkable is that all the politicians have a $950 health spending account. Rachel Notley has a $950 health spending account. Why should taxpayers pay for her to be able to get those services covered when we don't offer that to taxpayers? It seems to me if politicians are going to ask taxpayers to pay for chiropractic and their glasses and optometry and dietitians and nutritionists, all the things that aren't covered, we should offer that same benefit to all Albertans. So our proposal is to make the system more comprehensive, and it seems to me that the NDP's is to make it less comprehensive.
Hi, Catherine Gurkowski, Alberta Today. So I'm looking around, there's a dental office, there's a pharmacy here. Does the public health guarantee include what is being talked about at the national level, pharmacare plans, universal dental care? Is that part of the public health guarantee?
The public health care guarantee is that we are going to make sure that all of the services currently covered stay covered. And as I've said, we are looking at ways that we can expand the coverage to be more comprehensive. The prime example I gave was that we removed the user fees on public treatment beds. It used to be $40 per day. It was a barrier to people being able to receive mental health and addiction treatment. And it's made a huge difference in the lives of so many people. And so we will make sure that we consult with Albertans going forward, but our strategy will be to aim to get a more comprehensive system.
And an off-topic question. You ran on a promise to look into COVID measures, and I'm wondering, why speak to individuals as opposed to only your Justice Minister? Why have communications with individuals at all? As
I mentioned, I think people know when I campaigned, I was looking at options for amnesty. I was given advice from my Justice Minister that we had to await the outcome of certain court cases, and that's what we're doing. We're still awaiting the outcome of that. We also have Preston Manning taking a review of the legislation so that he can give advice for how we manage future pandemics, because I think we can look back and see what we did right and see what needs to be corrected, and I think it's responsible for us to make sure that we're preparing for the next pandemic in the best way we can.
Good morning, Premier. It's Safe Kaiser, Global News. I'm wondering, how do you expect Albertans to be confident in a Danielle Smith-led UCP healthcare system when you made comments last year regarding stage 4 cancer that were false, and now you've got more candidates making more false claims? And you've got people saying some questionable things around healthcare, like Petrovic, who 2 months ago, was saying, well, if you get a heart attack, maybe you need to manage your obesity or your diabetes or your congestive heart failure a little better.
Well, I'm pleased to see that the candidate you mentioned issued a statement yesterday clarifying that she could have used better language. I think we all need to make sure that Albertans have access to high-quality, accessible, publicly funded healthcare, and that's why we're here today. If people have access to good doctors who can help them manage their conditions, it's going to make sure that they maintain the best health possible, and that's why we have our public health care guarantee.
To use better language, Premier, numerous times you've said something, you've walked back saying you were taken out of context. That's what Petrovic did yesterday. She said she was taken out of context. Tory Tanner, Lethbridge West, had to step down because after claiming that kindergarten teachers were showing kids porn, she said she was taken out of context. Ironically, with Petrovic talking about personal responsibility, when's the UCP going to take personal responsibility for what they say rather than claim they were taken out of context?
Well, I think the two candidates in question did take responsibility. One offered her resignation, and I accepted it, and the other issued a clarification on her statement, and I accept that as well.
Hi, Miriam with CTV. Just following up on the first question regarding the investigation. Why are you refusing to answer questions regarding the investigation but openly talking about it on your radio show? Are you going against legal advice?
Look, the advice that I have been given is that we've got to let the ethics commissioner process play out. I respect the role that she has, and I'm fully cooperating with her.
But are you going against it by talking it on your radio show but not to media?
The advice I've been given is to observe the process. I'm fully cooperating with the ethics commissioner, and I welcome her examination of this, and we'll make sure I'll let her do her work.
And when did you first hear? It was just one more question. When did you first hear about the investigation from the ethics commissioner?
I'm sure you can consult with her office. I'm sure she would be happy to let you know. But as I said, I'm going to just observe the process and let her do her work and fully cooperate.
All right, we have time for one more call. Would you go into the lines? Operator, could you please put through the caller?
Thank you. Bill McFarland, CTV.
Thanks for taking my question, Smith. You've had controversial questions on health, and more recently on the matter they're now being investigated by the ethics commissioner. Are you concerned that some of your past comments are increasing the scrutiny on your candidates?
Sorry, you'll just have to repeat that because you were you were cutting in and out a little bit. Can you say it again, Bill?
Yeah, I'm just saying you've had to answer for some of these controversial comments. They've come up in the previous questions here today. Are you concerned that some of your comments in the past are increasing scrutiny on your candidates, taking away maybe some of the benefit of the doubt when maybe language isn't used as accurately as it could be?
Oh, well, look, I mean, I've had 27 years in public life making statements, and, there's sometimes that I have had missteps. I don't think that there is any doubt about that. I think people are forgiving when you give an opportunity to explain what you meant, and I want to extend the same opportunity to others. I don't think anybody gets into this business to hurt people. People get into this business because they want to help people. Sometimes we're not perfect in how we communicate, and I keep every single day working on that, and I'm going to encourage my candidates to do the same.
Thank you. And just as a follow-up here, what day was it that the commissioner informed you of the investigation?
As I mentioned, you can contact her office. I'm sure she'd be happy to share that with you. I'm just leaving it to the ethics commissioner to do her work and fully cooperating with her.
All right, thanks, folks. That concludes our press conference for the day. I will ask all of the UCP candidates to please join our leader up at the front. We'll do a group photo. And again, thanks, everyone.